Well, good evening, everyone. I'd like to get started tonight. Thank you so much for joining us for this Neighborhood Health Series, Help with Open Enrollment. We certainly are glad that this series has been able to continue virtually, but we also miss seeing you in person. I hope that you're able to check out our schedule for the rest of the year at speakers.roseman.edu. November 19th, we'll be talking about opioid abuse, and December 10th, funding higher education, which will be a really great topic for parents and students. We'll launch into new January programming, so please go to speakers.roseman.edu to check that out. Special thanks to Clark County Credit Union, our sponsor this evening, and they'll speak for us with us in a few moments. And now I'd like to move forward and introduce our speakers. Dr. Leanna Oswald obtained her Bachelor of Science in Nutritional Sciences from the University of Nevada, Las Vegas in 2004, and her Doctor of Pharmacy from Roseman University in 2007. She has 13 years of community pharmacy experience in Las Vegas and became a board-certified geriatric pharmacist in 2017. She currently serves as Assistant Dean for Academic Affairs and Associate Professor of Pharmacy Practice, as well as the Faculty Advisor for the American Society of Consultant Pharmacists at ASCP Roseman Student Chapter. Notable projects include creation of a Medicare call center on campus in which Medicare Assistance Plan trained pharmacy students reach out to provide unbiased help for Medicare beneficiaries. It's always a pleasure to have our students join us as presenters, and today I'd like to welcome two of our students. Our two pharmacy students who will join us today, Lindsay Roberts and Cassandra Little, are MAP certified counselors who have over 200 hours of combined experience assisting Medicare beneficiaries in Roseman's call center. Lindsay Roberts is a second-year pharmacy student. She has 2 kids and an awesome husband. She is a pharmacy intern at Smith's Pharmacy and is president of our on-campus senior care club, ASCP. She loves the senior population and has dedicated 120 hours in our Medicare call center in the last year and has loved every second of it. Cassandra Little is currently a P2 student and is the vice president of the ASCP club. Her hometown is Reno, Nevada, and she moved to Las Vegas to start pharmacy school, and she started volunteering in the Medicare call center on campus in May of this year. Please join me in welcoming Dr. Oswald, Lindsay, and Cassandra.
All right, thank you very much, Vanessa, for that great introduction. We are very excited to be here tonight. It is one of our fellow colleagues here likes to talk about eating an elephant. And today we are going to eat an elephant worth of information for Medicare. And hopefully along the way, we can make those bites a little bit more digestible, though you're probably still going to feel very full at the end of this presentation and maybe just a little overwhelmed. And that's okay because we've got resources for you to reach out to afterwards. Before I get started too far into the presentation, I would like to give a thank you to Clark County Credit Union for helping to sponsor this event. And I'd like to turn it over to Craig so that he can, Craig Fraley, share a little bit about his business.
I mute myself. Thank you very much. I want to thank Vanessa for putting this all together. I want to thank all the speakers for making this possible. Clark County Credit Union is proud to be a sponsor of Roseman's Neighborhood Health Series. If you ever need anything with financial wellness, we're here for you. We're open 24 hours a day, 7 days a week with real people on the phone. So you can call anytime at 702-228-2228. You can visit our website at ccculv.org and get all kinds of information. We do everything a bank does, but we do it for our members because we're owned by the members. Thank you guys again. Have a wonderful presentation tonight. Back to you guys.
All right, thank you so much. And if you want to, we can chat that number in for everyone as well, and they can get it that way also. All right, I also want to acknowledge just a couple of people. Some of them are actually here tonight as attendees, and that would be LaDawn Knighton, who is the Social Services Specialist for the Medicare Assistance Program Director through the Aging and Disabilities Division for the state of Nevada. We also have Catherine Lopin, who is also the AAIV and MAP Technical Assistance Specialist. They are huge supporters of our Medicare Call Center here at Roseman and have really helped to educate our students and provide bases of information that we're presenting tonight as well. So a big thank you to them, as well as MAP Services, which is provided through a grant funded to Dignity Health and we're going to talk about MAP services next. So what is MAP? And MAP is the Medicare Assistance Program for the state of Nevada. It's comprised of 3 federally funded grant programs. The first being the State Health Insurance Assistance Program, SHIP, which some of you might have been familiar with or heard of previously. And this is the program that assists beneficiaries, their families, caregivers with Medicare questions and provide unbiased, objective explanations to enrolling in Medicare. So there is no financial gain or benefit to having a member enroll in any certain plan, unlike going with a broker who might receive a kickback or money or financial incentive to enroll a beneficiary in a particular plan. SHIP doesn't do that. And so they operate under the auspice of MAP. And then we also have Senior Medicare Patrol, which empowers Medicare beneficiaries to prevent, detect, and report healthcare fraud and abuse. A great program, and we're going to talk about them again just at the end on a couple of tips to help prevent you from being a victim of Medicare fraud, or to help to report if you have identified Medicare fraud in any billing or anything that you receive as a beneficiary. And then we have the Medicare Improvement for Patients and Providers Act, MIPA, and this is a program that's geared towards assisting low-income Medicare beneficiaries with information and applications for cost savings plans. And so the students who are going to be presenting tonight, they've received training in all 3 of these areas, as well as our students who are part of the Medicare call center here at Roseman. And so what is the Medicare call center? Well, this is a nice picture of what it looks like inside of our Medicare call center. And these are students who volunteer and dedicate their time to get trained. We're going to do a 90-minute presentation for you guys tonight on Medicare. They spend over 16 hours diving into Medicare under the guidance of people like Kathy and LaDawn at the ADSD. And they complete modules, they get tested on the knowledge that they have. They spend time partnered, like you would see here, with someone who is a MAP certified counselor, and they get good at answering phone calls and helping beneficiaries. They also keep up to date. So every year they have to recertify on the new changes that have taken place with Medicare as the program evolves. And so if you're ever looking for help beyond today's presentation, you can always reach out to us at 702-968-6615. And we're typically there on Mondays and Saturdays to help to field calls that would normally go to the MAP office. And the MAP office, the Medicare Assistance Plan, does operate for the state Monday through Friday, 8 to 5 p.m. Throughout the week. Why give us a call? Well, since starting our program in 2016, we have helped to save patients and beneficiaries over 1.7 million in estimated annual healthcare costs. And so when we're able to identify a lower cost program so that your Part D drugs are covered for you for less, or programs that for patients who didn't realize that they qualify, or beneficiaries that didn't realize that they might qualify for extra assistance plans, we kind of track that a little bit and keep track of it. And we're very proud of being able to help patients afford their health care, which allows them to access their health care a little bit easier. So where is all the information coming from for this presentation? And I know that many of our beneficiaries are approaching the age of 65 or coming up to 65, but I also know you're all young at heart. So we used a lot of little children throughout here dressed up as older adults, just to signify that we recognize that while you might be a little bit older, you're still young at heart, and we want to make sure that you're getting the right information that you need. So this information is coming from Medicare.gov, which is the most trusted website for anyone who's got questions about Medicare. This one is run by the federal government. Again, it is not business incentivized. It is not trying to sell you product or make money off of you in any way. It is providing you the information from the Centers for Medicare and Medicaid Services. It is giving you the up-to-date real information, and it is how you should be, or a way that you can enroll for your Medicare plans. There's also a great resource called the Medicare and You 2021 book. And if you're Medicare eligible, you should have received this in the mail unless you have elected not to and you only wanted an online version. But if you haven't received it, I wanted to point out to the group here tonight how you can access this really good resource. And basically you're going to go to the Medicare.gov website. And once you're in the Medicare.gov website, you are going to click this tab over here called Forms and Help. And then you're going to scroll down to and select Medicare and You Handbook. And once you've done that, you're going to get some options. Do you want to download this in a standard, regular size 12 font? Do you want a larger print? Do you want to download an ebook to something like a Kindle? Because that's easier for you to read and flip on. You can also get an audio version. And there's a number here if you or a beneficiary you know would benefit from a Braille version, that can be requested as well. There's also some different drop downs that just appear in the screens that can be helpful to you as well. So if you wanted to find someone to talk to, like from the MAP program in Nevada, you would select your state, and then it's going to get you in contact with somebody that way. And then there's also some other quick check things here that we'll talk about later in the presentation. Is my test, item, or service covered? And you can kind of type in what you might be going for, and it's going to let you know if it's a service that Medicare covers or a test that Medicare covers. How are we doing so far? Hopefully everybody's doing well, because this is the easy part that we're in so far. We definitely want to make sure that you are using the .gov website whenever you're looking up. If you put in .com, Medicare.com, that's owned by a private company, and you're not going to be getting that unbiased information that you should be getting. The Medicare.gov site, as I've already mentioned, is run by the federal government. Also, what I showed you for downloading that Medicare and You book, that's going to be the nationwide version. The print version that you can get mailed for Nevada will also have Nevada specific information in it. At the end, it will list all the available Medicare plans for Nevadans. And so that is a very good resource that you can also put in and order from the .gov website, or it should be mailed to you if you haven't selected to only have an online version. So some basics on Medicare. It is the 55th year of Medicare. And so does anybody want to chat in at all? Who was president 55 years ago when this was signed into existence? Checking to see if anybody wants to type in that response. You can hit the chat on your function. I haven't seen any come through yet. So it was implemented in 1965 under, yes, Johnson, good job, Kim. It was under President Lyndon B. Johnson. And back then there were 19.1 beneficiaries, or million beneficiaries, I should say, not 19.1, 19.1 million. And now we have over 61.2 million beneficiaries. And in Nevada alone, we have over, we're creeping up to 500,000, we're just under, and we have over 475,000 beneficiaries throughout the state at this time. So who qualifies for Medicare? There are 4 main ways to become a beneficiary. The first is you age into the program, and we're going to talk about ways that you are eligible for Medicare as well. But turning 65 is one of the ways that you may qualify to have your Medicare coverage. The second is through disability. And if you're collecting disability pay for 24 months, on the 25th month, you would become eligible. Anyone with that is any age with end-stage renal disease may qualify, as well as patients who have Lou Gehrig's disease. And there is a 5th way to qualify, just one of those random Jeopardy facts. That would be if you've lived somewhere where you've been exposed to certain environmental toxins, you might qualify for Medicare as well if your city or your water or something along there exposed you to toxins that you need special care. So turning 65 is one way to become, to qualify for Medicare, but that's not the only way. You have to be Medicare eligible. And so you will be eligible at age 65 if you're a US citizen or permanent legal resident for at least 5 years. And then to get free Part A, you have to have earned 40 credits or have 10 years of paying into FICA. And you can buy Part A if you don't have enough credits or FICA payments to qualify. You may also qualify if you have been married for 10 years, even if divorced or deceased, and you don't have enough of your credits to qualify on your own. You might qualify under your spouse's record if you don't have enough credits earned. So you don't automatically get Medicare. You have to meet some of this criteria first if you turn 65. You can check for sure by contacting the Social Security office. You can go to the Social Security website, or you can call 1-800-772-1213 to determine if you are going to be eligible upon turning 65. If you're under 65, the way that you would qualify would be having the end-stage renal disease or Lou Gehrig's disease, or to be collecting Social Security for disability for 24 months. And then your coverage will begin on the first day of the 25th month. Flipping backwards to it being a birthday or turning 65, when it's coming up to you turning 65 and you're Medicare eligible because you've hit the 40 credits and paid your into FICA appropriately, then you have a 7-month period. And this would be the 3 months before you turn 65, your birthday month, as well as the 3 months after turning 65. Of this 7-month period, the best time, the ideal time to sign up is going to be the 3 months before you turn 65. This is going to ensure that your coverage will start the first day of your birthday month. If you are signing up during your birthday month or the 3 months thereafter, you're going to have a delay in that coverage starting. How do you get your Medicare card? Well, you need to make sure that the Social Security office has your most up-to-date address and that it's correct on file. If you're receiving Social Security benefits now, your Medicare card is going to come to you in the mail. If Part A was provided, Part A was earned, and your Part B effective dates. So you'll get your red, white, and blue card, and we'll see that on the next slide. And it's going to have the effective dates for when your coverage starts for Part A and Part B. If you don't do anything at this point, you're enrolled in Part A and Part B, and you have part of your Medicare coverage. If you're on disability, you'll receive your Medicare card with Part A and Part B the first day of the 25th month that you've been collecting those payments. If you're not collecting Social Security, you need to take some action. So some of you guys that have joined and are watching this webinar, perhaps you're going to be turning 65 this year. Or your loved one is going to be turning 65 this year. So now is the time to go onto the Social Security website, that's www.ssa.gov, or call the Social Security office, or go in person if you want to, and if they are open during the pandemic. And you'll want to make sure that you are registered to be receiving the benefits, and again, that they have your correct address on file. If you do not sign up for Part A and Part B, when you are first eligible, you may be subject to financial penalties. Some of them can last lifelong while you're on Medicare when you do sign up. So it is important to make sure that you have set yourself up to not just be eligible, but to make sure that you can obtain that coverage when you're turning 65. So I've mentioned Part A and Part B. Before we go into them deep, I just want to give a little bit of background for what each of these parts are. Part A, we like to think of it as admitted. This is going to be your inpatient services, whether that's hospital, skilled nursing facility, hospice care, home health. Part A, you want to think about as being admitted into a facility. Part B, on the other hand, we consider basic. This is your outpatient services, things that you'd use on a more daily basis, perhaps, than being admitted into an inpatient setting. So this would include doctor services, outpatient care, home health services, and preventive services. And there are so many preventive services that we're going to touch upon in Part B. And I really hope if you don't take anything away from this presentation, maybe that's one of them, that you have a bunch of preventive services once you're on Part B that you can take advantage of. Now I do know my alphabet. I swear I didn't put C before D, but this was intentionally done. The next part is Part D, which is your drugs. And this is drug coverage. So when you get that red, white, and blue card, and you haven't done anything to change any of the coverage, you're keeping Medicare Part A and Part B, you will still need to sign up for drug coverage. And Lindsay's going to be talking about that and some of the penalties that can come without signing up for that. But Part D is your drug coverage. And this is done through private companies that will help to provide you options to have drugs, medications covered. And then Part C, we like to think of as combined. Part C typically takes Part A, Part B, and Part D and rolls them into plans, again, from private companies that you can purchase that kind of give you your coverage for Part A, Part B, and most of the time the drug coverage as well. And this will kind of just make it, for some patients, a little bit easier to track services. And they also may come with some extra services that we'll talk about as well. So that's Part A, Part B, Part D, and Part C. So now let's take a look at the Medicare card. I've turned 65, I'm Medicare eligible, I have had all the information up to date with the Social Security office, and I get this red, white, and blue card in the mail. When you receive it, you'll have right here where your coverage starts. If you have been a beneficiary for longer or since before 2018 and you're part of our webinar today, you should have received a new card in 2018 that would have replaced your old card, which had your Social Security number on it. They now remove Social Security numbers and give a unique identifier number for each member of Medicare. You now may be wondering, well, do I have to accept these? And free Part A is good to accept, even if you have your own coverage through work or you're still employed, so you've got coverage. Part A, it comes to you, it's free, and we're going to talk about the services that it provides. But Part B is not free for most people. Well, for anyone actually. Part B does come with a monthly premium. It is income-based, and in 2020, we don't have the numbers for 2021 yet, they haven't been published. It would cost at the very lowest tier of payment $144.30 per month to have Part B. There is also a plan deductible to meet of approximately $197 for 2020. And so your patient will spend approximately just under, a beneficiary will spend just under about $2,000 a year before they start to recoup some of the costs for the services and equipment. So that's a lot of money. And if you have coverage through work, you may decide, I don't want Part B right now. I can delay it because I've got coverage for my outpatient and my preventive services that I already have. And if this is the case, then you will want to talk to your HR department. You're going to want to make sure that your coverage, you are still permitted. Some private insurances may require you, or some employers may require you to go on to Medicare once you qualify for Medicare, and they won't cover you anymore in the same manner. And you want to make sure that you are able to continue on with your private coverage. Active coverage will not include things like COBRA, retiree coverage, VA coverage, or individual health coverage through something like the Marketplace. So if you are currently getting private insurance through the Marketplace and you become Medicare eligible, you are not eligible for coverage in the Marketplace any longer. If you have TRICARE, active or retired, you generally must enroll in Part A and Part B when you're first eligible to keep your TRICARE coverage. So that's important to note. And if you have Medicaid and you don't have Part B, Medicaid can help you to enroll. Medicare will pay first, and then Medicaid will pay second for your costs. And Medicaid may be able to help pay your Medicare out-of-pocket costs like premiums, deductibles, coinsurance, and copayments as well. So when you've looked at all of that and you've weighed your pros and cons of having Part B, if you decide you want to refuse Part B, you are going to sign the back of your Medicare card that came to you, that red, white, and blue card, and you are going to reject Part B at this time. And they will send you a new card that will say that you have just the Part A benefit for Medicare, and you will continue to use your private insurance to cover your outpatient and preventive services. So I mentioned the marketplace, and if you currently have insurance through the marketplace, you will not qualify for help paying premiums once you are eligible for Part A. You need to be careful canceling your marketplace plan if it includes other family members. So if you're the primary and you have a spouse perhaps who isn't going to be Medicare eligible yet, and you cancel your plan, that your spouse is going to need to enroll in a plan through the marketplace. And opting out of Medicare when you are eligible and choosing to keep a marketplace plan can result in penalties and delays in coverage when you do decide to go with Medicare. And again, some of those penalties can be lifelong. If you're part of Marketplace, you may also get auto-enrolled in a Medicare plan. So your Marketplace plan may auto-enroll you into a Medicare plan when you become eligible. And so you need to watch your mail. There is a requirement for you to be notified 60 days in advance that you're being enrolled. And while this might sound really kind of smooth, like, hey, I don't have to do anything to get into Medicare, it may result in higher costs or limitations on doctors that you may be able to visit, or the process for how you may get to a specialist that you might not want. And so it is important to look at all of your options for Medicare when you do become eligible. Health savings accounts. It's also important to point out you cannot continue to contribute to an HSA or health savings account once your Medicare coverage begins. In fact, it's best to stop contributing 6 months before your Medicare start date. And this is because you may have to pay a tax penalty if you don't. And you continue to contribute, those dollars don't have that same tax incentive, and you might be taxed on what you put in. If you want to continue contributing to an HSA, you should not apply for Medicare, Social Security, or your Railroad Board benefits. And you can use your HSA funds that you have built up to pay for items within your Medicare costs. So if you have a nice HSA fund built up from several contributions over years, that money is able to be used to pay for your deductibles, your copays, and items that you would have to pay for while you're enrolled in Medicare. All right, so let's go over some Medicare lingo as I've started to throw out some of those terms like copays and deductibles. I like that. What did you say? And I'm going to give you guys a moment. If you can see this slide, if you're watching the presentation on your phone, this might seem kind of small and you can use your fingers to kind of expand the window. But I'm going to be asking and seeing if anybody wants to chat in the correct answers. There is a definition word on one side. So we have assignment, coinsurance, copayment, deductible, and premium. And there is a definition on the right-hand side. And so I'll give you a moment to see if you can match those up. I have been lucky to teach a lot on Zoom now, so I'm not as uncomfortable with those silent, awkward pauses as I used to be while people are reading or looking at the slide. But in the interest of time, we'll kind of match these up with their sides. So for definition number 1 for assignment, and I'm sure if I asked some of my students who weren't part of the Medicare group, they would have a very different definition of assignment. Does anybody know what the matching box is for assignment? A, B, C, D, or E? And again, you're welcome to chat it in. You can definitely use the chat function at any point to ask a question. We do have the students ready to answer those questions one-on-one. So you could send it just to the panelists, or you can send it to the whole group, to everyone, if you wanted to, and they would be able to respond, or we can pause and answer that question if you have one come up. So for this one, I saw Dennis, good job. You got it. It is E. So assignment is an agreement by your doctor, provider, or supplier to be paid directly to Medicare as approved by Medicare, and not to bill you for anything more than the Medicare deductible or coinsurance that your program or your plan sets up for you. Now, if you go to a doctor's office or a medical facility that does not accept assignment, they can charge you up to 15% more than your plan for the services that they are providing. So it's very important once you are a Medicare beneficiary that you are aware if this office that you are going to accepts assignment. And you can just ask that question, do you accept assignment? And the staff should be able to answer yes or no. And if they say no, we do not, then you might be charged more than you would going to a different office that accepts assignment. And coinsurance, this one is B. I'm sure many of you guys were able to get that one a little bit easier. And this is the amount that you'll be required to pay as your share of cost of services after the deductible has been met. So usually it's a percentage. For example, a lot of Medicare Part B, what's covered is 80% of the cost, and the patient, you the beneficiary, are going to be paying 20% of the services or costs. Anybody want to guess what oh, Sarah Lynn, nicely done. I see all of your answers in here. That's one of our HR managers here at Roseman. And she sent her answers to the panelists. Anybody want to type their answer in for number 3 here, copayment? All right, that is D, yes. Copayment is a set amount that you're going to pay for a service. So where a coinsurance is going to be usually a percentage amount after you have met the deductible, your copayment is a flat payment. So we can think like your generics are going to cost, your generic medications always cost you $10 as long as you get them on formulary. Or if you go to the doctor, the visit is always going to be $25 or $15. That's a set amount. The deductible, which I've mentioned a couple of times, this is going to be C, and that is the amount you must pay for healthcare or your prescription drugs before original Medicare or your plan or your insurance begins to pay. And so you need to hit that deductible amount for Medicare Part B. I had mentioned that in 2020, the deductible was $197 that you had to pay out of pocket in addition to those monthly premiums. And so what is a premium? Well, that leaves us with A, and that's the periodic payment, often monthly, usually monthly, to Medicare or an insurance company or a health plan for health or prescription coverage. And so typically your Medicare coverage, so we have a Part B premium that we pay monthly, and many of the drug plans also have premiums that you'll pay monthly. How are we doing so far? Anybody have any questions? Again, you're welcome to chat those in, and you can send them just to the panelists or you can send them to everyone. So we went through this as kind of the parts of Medicare, Part A, Part B, Part D, and then Part C, which combines coverage for all 3 of these areas. It's now important to point out that you have 2 options when it comes to selecting your Medicare coverage. Option 1 is to just get Medicare, original Medicare, which is going to include Part A and or Part B. And then when you do this route and you go with original Medicare, you will have your Part A and Part B if you haven't waived out of it. And then you can also add Part D coverage. And then when you are on this track of getting your Medicare coverage, you can also look at a Medigap private Medicare supplemental insurance plan. And we're going to talk about some of the benefits of signing up for that early on as well. The second option for your coverage is to do a Medicare Advantage plan or Part C. And this is, these plans are either HMO or PPO based, and they may include, usually for Nevada, include Part D coverage. So essentially you take Part A, Part B, Part D, and you roll them into one program for coverage. When you are on Medicare Advantage, you are not eligible to get Medicare private supplemental insurance as well. So let's compare original Medicare and Advantage plans a little bit deeper. When it comes to the provider of the plan on original Medicare, it's the provider is Medicare directly. When you are looking at an Advantage plan, the provider is private insurance. When you're talking about which providers, doctors, hospitals, skilled nursing facilities, if you're on original Medicare, you get your choice of providers that accept Medicare nationwide. So if you travel a lot, if you're going to be going out of network often, across maybe you have grandchildren throughout the states that you go and you visit frequently, it won't matter which state you're in, you're covered for anyone who accepts Medicare. On an Advantage plan, you're going to be limited to the plan's preferred providers, or you might pay more out of pocket for your services. When it comes to the Medicare Part B premium, you're going to be paying this for both an original Medicare track or for the Advantage plan track. When it comes to Part D coverage, you're going to need to consider this under original Medicare and sign up for a plan on your own. When it comes to an Advantage plan, you may need to consider it, but for most of the plans, again, in Nevada, it's already going to be rolled into the Advantage plan. And then supplemental insurance, you would need to consider it if you're on original Medicare, and we'll talk about how that can help some of the costs that come with Part A and Part B coverage. But if you have an Advantage plan, you cannot get a Medigap policy or supplemental insurance plan. All right, so what are some of the costs that are associated? I remember when I first came to the US, I'm from Canada originally, Vancouver, British Columbia. I thought Medicare would be awesome because it's just like being in Canada. It's free coverage when you turn 65. And then I learned through this process of working with our students and working with the MAP program, Medicare is not free. So when we look at some of the lines here for what there can be costs associated with, for Part A, it is typical to have varying deductibles for services. There is usually no monthly premium unless you didn't meet all of the criteria to be eligible. And then you may pay up to $458 a month to have coverage. And this is based on 2020 numbers because 2021 numbers aren't published yet. So I can just give you what we have for 2020 so far. When it comes to Part B, we talked about already, there's that $197 deductible that needs to be met on an annual basis, and then a monthly premium that starts at $144.60, though there's a little asterisk there because that's actually income-based, so you might pay more than that. And then you're also going to pay 20% out of pocket for most of your services and fees, although there are a lot of free preventive medicines. And so do want to point that out there, that you do have a lot of free options for preventive care. Part D, to get drug coverage, you may pay as little as $0 or as much as $435 in 2020. This is the only number that I know for 2021 because it's up on the Medicare.gov website, and this has gone up $10. So it might go up to $445 for an annual deductible to have Part D coverage. And then you will also see that there is a monthly premium associated that can range anywhere from $13 to $82-ish. And that has an asterisk too, because it's income-based. And it's based, and we'll talk about that, on your taxes that were filed up to 2 years ago. So you might pay more than that for a monthly premium. And then you can have copays ranging anywhere from $0 to $47. Our drug cost percentage of coinsurance is for 18 to 50% of your drug costs under Part D coverage. And then if you get supplemental insurance, which will help to offset some of the costs that were listed here, you can expect to have an annual deductible cost as well as monthly premium costs associated with that as well. So Medicare, which I thought would be free, is definitely not free. And this is where it can start to shape the plans that you decide to go with, and why our Medicare call center has been able to save so many people so much money through finding plans that are more cost effective or that meet the needs of the patient, the beneficiary, the best way that they can be served. What's not covered? Items that are typically not covered under Medicare include most dental care. Some plans have some very, very basic dental coverage, eye examinations, dentures, cosmetic surgery, massage therapy, acupuncture, hearing aids, and exams for being fit, long-term care, concierge care. There's a good list that starts on page 25 of the Medicare and You book, and you can kind of find out what Medicare covers for you. So let's go ahead now and dive in just a little bit more into the specifics of each part A, B, D, and then we'll go into Advantage plans and supplemental insurance as well. How are you guys doing? Hopefully everybody's doing all right. We're at the 45-minute marker. If you're in the classroom, actually, what I would normally do right now with you is get everybody to kind of stand up if you've been sitting so far, and just stand and shake a little bit. It's hard to kind of, oh, I see Vanessa getting up there. It's hard to sit for these long periods of time. So you want to stay fresh as you get this information. So that's sometimes with our students, because we go 6 hours a day in the classroom, we like to get them out of their seats, shake them up a little bit, make sure they're awake. All right, we talked about Part A, and Part A means we like to think of it as admitted. Part A, some things that this will help to cover. So this can be inpatient care in a hospital, inpatient care in a skilled nursing facility, not custodial or long-term care, hospice care, home health care, inpatient care in a religious non-medical care institution. These all fall under the auspice of Part A coverage. Now, I put in quotations here, free Part A, and this would be the cost for an inpatient stay if you are on original Medicare and you do not have a supplemental plan to assist with some of these costs. And this is based again on 2020, so we can expect the numbers will be around here, but probably slightly higher. I haven't really seen too many times where the numbers have gone lower. They might be slightly higher for 2021. If you are inpatient in a hospital and you are in the first 60 days, so days 1 through 60, you have a $1,420 deductible to meet. And again, that's for 2020, might be slightly different for 2021. If you remain in the hospital for an additional 30 days after that, you're looking at a cost of approximately $355 per day. From there, you have $710 per day during what we would call a 60 lifetime reserve day kind of pot of days to use. And once you hit 150 days, you cover out of pocket all costs associated from there on out. And this is for each benefit period. So a benefit period, what you see at the bottom of the slide here, counts as the first day that you were admitted as an inpatient. And then that benefit period will end if you have not received any inpatient services for 60 days in a row. So if I go into the hospital and I'm there for 3 months of time and I come out and I'm good for 60 days, so I'm out for 2 months, and then something else happens where I go back into the hospital, this whole chart starts again, except for that you have a maximum of 60 lifetime reserve days. So you can incur some costs pretty quickly through Part A if you end up in the hospital or as an inpatient for an extended period of time. This is also why it's important to make sure that you understand, or your loved ones that might be caring for you, the importance to ask if you are inpatient or outpatient when you are in the hospital. Inpatient starts the day that you are formally admitted into the hospital with a doctor's order. So just being in the hospital, even spending a night in the hospital, does not mean that you are admitted to the hospital unless you have a doctor's order that has admitted you. The day before you are discharged is your last day, last inpatient day. That's how Medicare tracks it. Your outpatient, if you're getting services and the doctor has not written an admit order. You can be outpatient again, even if you spent the night. I think it really stuck with me. I had mentioned Kathy on the phone here before, but there have been cases in Nevada where somebody has been in the hospital for several weeks without having admitting orders. And so why is that important? Well, that can cost you money. Again, inpatient costs are going to be paid from a combination of Part A and some of Part B, depending on the what's being provided. But outpatient costs are only paid for from Part B, and that's 20% of the bill. And so that can get very costly if you're classified as an outpatient in the hospital, but receiving what would be equivalent to inpatient services. Also, to qualify for a skilled nursing care through Medicare, you do need to have a three qualifying day stay in the hospital, which is also important to make sure that those admitting orders are provided. Now, with COVID, there are some loosened, I don't know if loosened restrictions is the right, but some modified verbiage around the 3-day rule. And so that's important if you have a loved one that's on Medicare and is COVID positive for where they may move them to. They may not have to be in for 3 days to be moved to another facility and still have it covered. When you transition into a skilled nursing facility, there are also payments associated with Part A. So the first 20 days, it's covered. And so that's a zero out-of-pocket expense. But then the next 80 days, it will cost, for 2020, $177 per day. And if you hit 100 days, all costs will be paid out of pocket. And again, when we look at these extra costs associated with the plan, this is where a supplemental plan, a Medigap private insurance supplemental plan may be beneficial to enroll for early on because it can help to offset these costs as well. Part B, talked about as being basic care. And Part B, oh, isn't this a scary looking chart? This is income-based. So if you remember on that slide, I had a little asterisk when I said that the monthly premium for this was going to be $144. That was if you filed an individual tax return and made less than $87,000, or a joint and made less than $174,000 in 2018 for 2020. So we would be looking at 2019 taxes for 2021. And depending on your what you filed for, your monthly premium, not your copay, I was about to say that wrong, your monthly premium will go up. The higher your income, the higher your premium will be. So that if you're fortunate enough to be making $500,000 or more a year, or filing for that much, or you filed for that much in 2019, it is likely you'll be close to almost $500 a month for that Part B premium. This also comes into play, this is the monthly premium, that comes into play for you deciding if I'm still employed and I have coverage through my work and I'm making, maybe I make a higher amount of money, even though I'm Medicare eligible, again, that might be a reason that you want to decline Part B coverage to avoid this monthly payment. Part B does have some great preventative services, ranging in anything from a yearly wellness visit all the way down to immunizations, flu shots, hepatitis B shots, pneumococcal shots, and a ton of screenings. I always think of my father-in-law when I get to this slide, because he is someone who, once he qualified for Medicare, I won't tell you how many years ago, but it was several years ago, he wanted to get everything. He was maxing out his benefit and going to do every preventative service. And he thought he was just healthy as a horse. And he did the aneurysm screening. That's aortic aneurysm screening, and found that he actually had an aortic aneurysm that was almost 3 centimeters large on his aorta in his heart, which he would have never found. He's on medication and the aneurysm has gone down. And so These screenings they can be life-saving, and they are covered as a benefit on Part B. So I can't encourage enough for Medicare beneficiaries to take advantage of these. This is also some data on the Medicare.gov website of how beneficiaries back in 2017 used some of these preventive services. And so blood pressure screenings, approximately 96% of beneficiaries took advantage. Pneumococcal shot, your pneumonia shot that you start to get at 65 and then again 5 years later. 80% of patients, beneficiaries got that. And then the flu shot, 70%. So if you've got Part B or you qualify for Part B this year and you go on to Part B, you do qualify for some of these vaccinations as well. Part B also can cover some durable medical equipment. And Nevada is part of Medicare's competitive bidding program. And what that means is for Medicare to pay, you must get your equipment or your supplies from a Medicare approved supplier. So they have to be approved through Medicare to sell DME that Medicare will pay for. Contracts and suppliers and competitive bid categories can be found at Medicare.gov, so you can find someone local here in the Las Vegas area. And you typically will need a prescription or written order from the doctor in order to be able to get this covered under your Part B benefit. These are just a big long list of examples of things that can be covered, but I think it's also important to point out that sometimes that your coverage will only cover the rental of these and not necessarily the full purchase. So when you're no longer using the product, you have to return it back. All right, now that we've covered Part A and Part B, and we've seen some of the costs associated with it, here are original Medicare supplement plans, and this is where it would factor in. If you picked the left side of the slide that was shown when you had your two coverage options for Medicare, and you go with standalone Part A and Part B, you will want to consider a supplement plan or a Medigap plan. And what can that help with? Well, when you look at all of the costs that we had listed out, it falls into this line here. And these are private insurance plans that help to offset the costs that we're seeing in the first three lines over, well, first two lines over here of Part A and Part B. They don't help with drug costs at all. They are identified by a standardized policy letter. So there's A through D, F, G, K, and N. And this past year, people who were new to Medicare could no longer purchase a supplemental plan that would cover their Part B deductible. So there used to be the option where the plan that you purchased would cover that Part B deductible and you didn't have to pay that out of pocket, but that ended in 2020. So plans C and F will not be available to newly eligible Medicare enrollees in 2020 or 2021 going forward. This chart can be found on page 72 of that Medicare and You 2021 book. And it kind of highlights out here the benefits of taking these plans. So if I went with supplemental plan A, for example, I'm going to have some additional coverage for the coinsurance hospital costs, my Medicare Part B coinsurance or copayment costs. It may also cover things like blood, if I need to receive blood transfusions, as well as Part A hospice care. But that kind of ends there. And you can see the differences in coverage plans here and the amounts and what they're going to cover. And there is an out-of-pocket limit that existed for 2020. Again, we don't know what 2021 will be, but usually they're somewhat close of $5,880 for Plan K and Plan L, $2,940. Lots of fine print to read there. But also some real benefits to joining into a Medigap or Medicare supplement plan early. In fact, the best time to buy is within the first 6 months after turning 65 years old and you're enrolled in Part B. You do have to be enrolled in Part A and Part B to be eligible for a supplemental plan. And during that first 6 month period, it's pretty nice the private insurance company cannot deny you. If you want to enroll on the plan and you pay the premiums and costs associated with it, you're in the plan. After that 6-month period, it is possible that you can be denied for prior existing conditions, or even something as simple as age. And so if you do, once you do become Medicare eligible and you have accepted A and you've got Part B as well, signing up for a supplemental plan can save you a lot of money in the long term. Signing up for one later, you can actually be denied for coverage outside of that 6-month window. It's also important to note you can't acquire a Medigap policy if you're under 65 years old in Nevada, or if you have a Medicare Advantage plan, because you've already got private insurance coverage. So this would be only if you have standalone Medicare. What else should you know about Medigap? Well, I already mentioned you have to be have Part A and Part B to get a Medigap plan, that it is a private insurance company. So in addition to the other deductibles and premiums that you have for Part B and your possible drug coverage, you would have additional premiums to pay to the private insurance company as well. A Medigap policy only covers one person. So if both you and your spouse are Medicare eligible, you would both have to get your own Medigap coverage plans. You can't have drug coverage in both Medigap and your Medicare drug plan. So the Medigap plan really only offsets costs for Part A and Part B. Part D, remember, that's private company as well, so you can't overlap on that. And then it is really important to just compare policies and prices, and Cassandra is going to show you how to do that coming up in just a moment on how to look at the Plan Finder tool, and there is a way to compare supplemental plans as well. All right, and for Part D coverage, if you're tired of hearing from me for an hour now, I'm going to turn it over to our student, Lindsay.
Hi, everybody. So we're just going to go over Part D. We're going to go over some subsidy programs and also a little bit over Part C, just to go over that a little bit better. So Part D is going to be your drug coverage. You can switch it, Dr. Oswald. So the drug coverage, like Dr. Oswald had said before, it is based on income. So your plan premium is going to depend on how much you make yearly. So again, with the scary looking chart, but it is just based on income and how much the plan premium itself is. But those totals will add up on your monthly premium depending on your yearly income. So if you would like to opt out of Part D, that is possible. If you're currently employed and your employer provides insurance, that's fine. You can do that through Social Security. You have to provide a letter of credible coverage from your employer. You would receive something like that from your HR department of your employer. They are required by law to give that to you. So if you just ask your HR department, they'd be able to give that to you to provide to deny Part D. So how Part D payments work, if you've ever heard of the donut hole, that's also just known as a coverage gap with Part D plans. So after you and your plan have paid up to $4,130, you will enter a coverage gap or the donut hole. And that you would have to pay up to 25% during that time, whereas your plan pays about 70%. Once you reach the $6,550 mark, you would enter catastrophic. Those would enter you into set amounts that you would pay for your drugs. We'll talk more about we'll talk about catastrophic coverage a little bit more here. But once your out-of-pocket spending reaches that $6,500 mark, you're now entered into catastrophic coverage, and you would pay no more than 5% of your normal drug costs. So if you are planning on paying up to about $6,500 in your drug costs for the year, if you know you're going to hit that mark, it's really smart to have those drug costs ran through your Part D instead of paying cash prices or using other apps. But if you know you're going to be below that $6,500 mark, you would it would be more beneficial for you to ask your pharmacist if that's your lowest drug cost, what they've ran through your Part D. You could also ask if there's apps. You could use an app called GoodRx. There's other saving apps for prescription drugs. But you wouldn't want to delay that catastrophic coverage if you're going to hit that $6,500 mark. You would want to pay up to that to get to that 5% as quickly as possible. So there are some special programs. These ones are state, the one we're going to talk about first is state specific. Dr. Oswald touched on Medicaid previously, but Medicaid, once you are in the Medicare portion of Medicaid, there's different levels of Medicaid through the state. You may qualify for that, and this is based on income and resources. So you may get assistance with Part A, Part B premiums, and then also copays and deductibles and things like that, depending on the level that you are qualified for. Like I said, this is based on income and resource criteria. So right now, these are examples from 2019. They do change every year slightly. It might be slightly different, the income limits. But that's ran through the state welfare program, and they would be able to tell you more about what level of Medicaid you would qualify for based on your income and resources. So there's also a federal program. The Medicaid program was through the state of Nevada, or any state would have some kind of Medicaid program likely. This one's a federal program through Social Security. This one is for prescription drug assistance, and it's called Extra Help. There's full and partial extra help depending on income. So this would provide assistance for Part D premiums. It would also provide assistance for copays and deductibles, and this is for people with low income and low resources. You would pay a maximum of $3.70 for generic and a maximum of $9.20 for brand. That's with full extra help. Partial extra help is a percentage of how much they would cover, and that is also based on income. So that the extra help would be done through Social Security. Now, penalties apply to all three, so Part A, Part B, and Part D. So delaying enrollment into any of these parts if you are eligible and you don't have credible coverage through an employer. So Part A would be a penalty of 10% times double the number of years that you missed. Part B is 10% increase for every 12 months annually, and that one's a for life penalty. Part D is also a penalty, and you would pay 1% of the national premium average, and that would be per month that you did not enroll in a Part D once you were eligible, and that's also a lifelong penalty. So that gets added onto your premium payment. Once you stop your employer's coverage, or once you are no longer covered by your employer's coverage, you have 63 days to enroll into a drug plan to avoid that penalty. Another thing to mention is that there is also a 6-month guaranteed right of issue period where supplemental insurance, like what Dr. Oswald went over, the Medigap policies, there's a 6-month period that they cannot deny you for past medical history or things like that, other conditions that you might have. That 6-month period is the time where you can apply, and they cannot deny you for those things. But once you pass that period, they do have the right to deny for past medical history or anything like that. So you do have to act on those as well. And just a reminder, you're only eligible for that if you are over the age of 65 in Nevada and if you are not a part of a Medicare Advantage plan.
Lindsay, you had a good example of a beneficiary who delayed their Part D for an extended period.
Yeah, so in the call center, I had one beneficiary who was 78. She did not have a Part D because she didn't take any drugs until she had turned 78. And so she went from 65 to 78, occurring monthly penalties of that 1% times the national premium average. She ended up being qualified for one of the subsidy programs, which actually ended up waiving that penalty for her. But that was just by chance. If her income had been any higher, she wouldn't have been qualified for that, and she would have incurred over 10 years of penalties on a monthly basis. So you really got to be careful of that. Even if you don't take any drugs, you still get those penalties if you don't enroll. So Part C is going to be your Advantage plans. This is your combined plans, your A, your B, your D all together. Generally, D is included. We'll go over that a little bit though. So combined Part A, Part B, and Part D. Now, these are provided by private companies. Ones you may know, places like Humana, AARP has some plans, Blue Cross Blue Shield, those common ones, they offer Medicare Advantage plans. So just like on previous employer insurance or something like that, they offer HMOs, PPOs. And then in some states, they offer special needs plans. HMOs, just as you knew them before, they do require in-network visits. They do require you to choose a primary care physician to be put on your card. And they require referrals for specialists. And these plans may offer additional benefits. We'll go over that a little bit more specifically in another slide. PPOs are generally the more expensive types of plans, but they allow in and out of network costs. So they'll give you a price for in-network and they'll give you a price for out-of-network. You may not need a referral. It's not 100% with PPOs, and you may not need a chosen primary care physician. These ones would also potentially offer additional benefits as well. SNPs or special needs plans, those do require in-network. They also require you to choose a primary care physician and referrals to specialists. But these are for people with special conditions. This is not something we tend to see in Nevada, but it may be more prominent in other states. So with a Medicare Advantage, some things to consider when you're thinking about a Medicare Advantage, although their cost is generally lower than being on original Medicare, sometimes with certain networks, you have to stay within that network. So for example, if you get on a Humana plan, you have to stay within that Humana network of doctors, specialists, and things like that. You may need referrals, so you can't just make an appointment and see your specialist whenever. You have to go through your primary care physician. One of the benefits of being on an Advantage plan is that there is a yearly limit on your out-of-pocket expenses, which is different than original Medicare, which has no out-of-pocket maximum. Another thing to consider is that you cannot buy those supplemental coverage insurances that Dr. Oswald went over. As far as coverage, they have to offer everything that original Medicare covers. That's one of the requirements of having an Advantage plan. Generally, drug coverage is included. In the state of, or in Southern Nevada, most plans do include drug coverage, but that would vary state to state on whether they include that or not. And there are a lot of additional benefits within Medicare Advantage plans, like dental, vision, and hearing allowances that you're able to use, but that varies by plan as well. So Medicare Advantage plan costs, those range. A lot of the ones you'll see, and Cassie will show you the Medicare Plan Finder, and it'll pull up a few examples of some Medicare Advantage plans. But some of the monthly premiums are $0. But what that means is it's $0 additional dollars to your Part B premium. So you would still pay that $144.60 or more, depending on your income level. But the monthly premium for the Medicare Advantage plan could range from $0 to $180 additional dollars on top of that Part B premium. The out-of-pocket limits are generally about $1,000 to $10,000. Your annual Part D deductible can be between $0 and $435. And the co-pays for drugs is generally between $0 and $100, depending on the plan and depending on the drug. It can also go up to 33% co-insurance. So when you get an Advantage plan, if you decided to go that route, they would issue their own card. So it looks just like an insurance card you would get from an employer or another participant there. So if you decided to get on a Medicare Advantage plan, you would store your Medicare card, your red, white, and blue card, somewhere safe, but it wouldn't necessarily need to be on your person at all times. This would be the card that you would take to your pharmacy, your doctor, or anywhere else that would need your insurance card. This is an example from Blue Cross Blue Shield, but it's their own insurance card with their own numbers. So determining which route to go, Dr. Oswald had the two sections. She had the original Medicare and then the Medicare Advantage. Deciding how to determine what would be best for you. There's three things we say to heavily consider. The first one being your health. what your health needs are, if you have specialists that you need to see, things like that. Those all need to be taken into consideration. Cost, what your income looks like, what you can afford monthly and yearly. And then lifestyle. She talked about traveling a little bit. So all of that needs to be taken into consideration when you're deciding on a plan.
And one more area that you can think about is the star ratings for a program. And star ratings are heavily rated or heavily weighted into a customer satisfaction on what they felt about the plan. Were they able to get services covered? Were they able to see the doctors they wanted to? Did they feel like they got good care on that plan? And then there's an aspect from the plan, from the doctors and the other people enrolled in the plan as well. And so when you look at these plans, you'll also see some star ratings for them as well. And that could play into you picking one plan potentially over another when it comes to the coverage, the different coverages.
So up next, Cassie's going to go over the Medicare.gov plan finder and show you guys how to kind of navigate that. She'll also show you an example of those Medicare Advantage plans and what those look like. So I'll pass it over to Cassie.
Okay, so there are many Medicare Advantage plans. There's a lot of Part D drug plans, and there's a lot of Medigap plans. So an important tool to use is the Medicare Plan Finder, and this allows you to look at and compare all the different plans so you can pick the best one for your health. So I'm going to walk you through how to access the Plan Finder. But first, some things that you might want to have handy for yourself before you use the Plan Finder is your Medicare ID card. You will need that number on there, as well as the effective dates for your Part A and Part B, which should be on that red, white, and blue card as well. You will also need like a list of your medications that you're taking, including the dosage, the strength, the quantity that you get, and how often you get it from the pharmacy. You will also need a list of your preferred pharmacies, whether that's retail or mail order pharmacies. And then you'd also want to get a list of your doctors. And this is mostly so you can check to see if your doctors take the plan that you've selected. And that's an important thing to keep in mind, is that not all doctors take the same insurance policies. All right, so now I'm going to pull up Medicare.gov and show you how to access the Plan Finder. Give me 1 second. There we go. Okay, so this is Medicare.gov, and like Dr. Oswald said before, it's important that you go to medicare.gov, not .com, and this is the website that you will see. So there's two ways to access this Plan Finder. The first way is to log in or create an account, and we recommend that all beneficiaries create an account so that they have all their Medicare information in one place, and then they can look up their coverage, any claims that they have, what their costs are, will all be in their Medicare account. So this could be very helpful. But you can access the Plan Finder without creating an account, and I'll show you how to do that. If you click on this little icon on the bottom right, this will take you to the Plan Finder. So this will bring you to another page just asking if you want to log in or continue without logging in, which is what I'm going to do. All right, so it's going to bring you to this page, and it's going to ask you what you want to compare. So Medicare Advantage plans, drug plans or Part D plans, and Medigap policies. So those are the three options that you can compare. So when you sign up for Medicare, you will sign up for Part A and Part B through Social Security. But with Original Medicare, you will need that Part D drug plan. So that's why you would come to this Plan Finder and then look at the drug plans. With Original Medicare, you also might want to get a Medigap policy or a second insurance policy. So you can also look at the Medigap policies in the Plan Finder as well. But then if you wanted to switch from Original Medicare to an Advantage plan, then you can look at all the Advantage plans that are offered in your area, also within the Plan Finder. So those are the three reasons why you would want to use this Plan Finder. So I'm just going to walk through an example with you, and I'm just going to look at the Medicare Advantage plans. So I'm going to select that, and then I'm going to enter my zip code. So this will pull up all the Medicare Advantage plans that are offered within my zip code. Okay, and then it's also going to ask what subsidiary programs I use. I'm just going to say that I don't get any help, but if you use any of these, feel free to select those. All right, so then it's also going to ask me if I want to kind of compare my drug costs. And so if you take any drugs, this might be important to do just so you can see your yearly costs as well as your monthly costs. So I'm going to press yes. And then it's going to ask me where I normally fill my prescription. So I'm just going to say I fill them at the retail pharmacy. And then I'm going to move on. So this is why getting a list of your prescriptions was important, because it's going to have you add your medications. And I'm just going to walk through a few examples with you. So I'm going to type in lisinopril, and it's going to usually have a drop-down menu so you can select it. And I'm going to add the drug, and it's going to ask me my dosage, the quantity, and the frequency, and you can change it with the drop-down window, as you can see. And then I'm going to add it to my drug list. And so you can continue doing this for all of your drugs. I'm going to do one more. So one other thing, if you enter in a brand name, it's going to have another little window pop up. That's just going to tell you that generic is also available. And this is probably going to be a lower cost. The generic is usually lower than the brand. So I'm just going to add the generic. Again, dosage, quantity, and frequency. And I'm going to add that to my drug list. So you can add as many drugs that you are on to this list. And then when you're all done, you're going to press this button. And then it's going to ask you which pharmacies you use. So you can actually change the zip code here if you go to a different pharmacy outside of your zip code, or you can put in the name. You can select up to 5 pharmacies to compare. So for example, I'm just going to select mail order because maybe I might be interested in doing mail order, Walgreens, CVS, and Smith's. So you can see down here at the bottom, the 4 pharmacies that I've chosen to compare. So I'm just going to press done and save those. Okay, so now it's going to bring me to a whole list of Medicare Advantage plans that are available in my area. So you can see I have 41 plans to look through in the Clark County area. Let's see. So this is kind of a lot of plans to look through. So there's a few ways that you can filter this or limit this to a lower number. So I'm going to go over to Filter Plans button on the right side. I'm going to click that. There we go. So this is just going to ask you what you're looking for. So you might be looking for vision and dental specifically. You might be only interested in PPOs or HMOs. You might also be interested in things that are only 4 stars and up. Also, you might only want a certain insurance carrier or a drug coverage option. So those are ways you can filter this long list. So I'm just going to apply these filters. So now I only have 10 plans available. And again, I can sort these plans using this window on the right hand. And this is just another way to list them. So right now it's the lowest drug plus premium cost. But you can change this to lowest monthly premium or lowest yearly drug deductible, whichever is more important to you. So I'm just going to leave it at lowest drug and premium cost. All right, so now I'm going to look at the list of plans. So the first one here is the Humana Gold Plus plan. And so it's just going to give you some of the details in this little square here. So you have your monthly premium, which is $0 on top of your Part B premium, the $144. So you will still pay that Part B premium, but there's no additional premium you'd have to pay for this plan. Also shows you your yearly drug costs and premium costs, as well as other deductibles. On the right-hand side, you can see additional plan benefits such as vision and dental, and also your copays and insurances. So now you have the overview of this drug plan, but if you want to see additional information, you can go down and press this blue button, the plan details. And that's going to take you to a different screen. And basically, this screen is going to give you another overview, going to show you all the benefits and drug costs, star ratings, and contact information. You can actually use this contact information to contact the insurance company and ask them more specific questions about their insurance plan. So this shows you your premiums again, your deductible, but also breaks it down into your doctor visits, your labs and tests, hospital services, preventative care. It breaks it down to like each service and benefit that you receive and what you would pay for them. All right, so going back up, we're going to go back to that last screen. All right, so that showed you the additional plan details, but you can also view the drug cost specific to this plan. And you can do that by going to the bottom right. There is view drugs and their costs here. So here it's going to pull up the drug costs for all the pharmacies that you've selected. So the first one here is Smith's Pharmacy, but there's also CVS and so forth. So looking at this chart that they present to you, this is going to give you the retail cost, your cost after deductible, your cost in the coverage gap, and your cost after the coverage gap. It's also going to give you your estimated cost per year and also a breakdown of how much you'd pay for each month. So this might be a helpful tool if you're deciding whether you're going to reach that catastrophic coverage that Lindsay was discussing earlier. This might be helpful for you to also decide which plan you want. All right, so going back up again. So those are the details that you can get for one plan. But if you wanted to compare multiple plans, say you wanted to compare this Humana to a few others like the AARP plan or the Select Health plan, all you would do is click this button that says Add to Compare, and you can compare up to 3 plans. Let's go ahead and add 3 here. So what this is going to do, it's going to compare all 3 plans. Are going to be side by side for their premium deductible. It's all going to be right next to each other, so you can quickly look across and compare them. But it can compare their premiums, their deductibles, their additional plan features. You can see the differences there. Also, any kind of copays you pay for doctor visits, labs and tests, hospital services, extra benefits that they might have, you can compare them. Their drug costs also with each pharmacy that you've selected. And then down here at the bottom, say you were interested in one of these plans over the other after comparing them, you can again see those plan details, the breakdown of the plan in more detail, or you can go ahead and enroll yourself in that plan. So if you wanted to enroll yourself in that plan, you'd go ahead and press enroll. And it's going to bring you to this small window that basically says you're going to need your Medicare ID number and some health coverage information in order for you to enroll. So you would just press join plan, and then you would start the 7 steps to enroll in this plan. So that's why you also wanted to get this information before you started this, so you could just go ahead and fill this out. All right, so now we're going to go back to the presentation. Okay, so I showed you in the Plan Finder how you can enroll in a certain plan. But to enroll in Medicare, you first initially would go to Social Security and you would enroll in Part A and Part B. And that you can do that through their website here, ssa.gov. And then you would go to medicare.gov to use that Plan Finder. So again, you could go there to switch to Advantage plans, or you could just go there to find a Part D plan or to find a Medigap policy. All of that is at the medicare.gov. You can also look up your eligibility and what your premium cost would be by also going to medicare.gov and using this specific link. All right. And then I'm going to hand it back to Dr. Oswald.
All right, we are there. We're in the final 5 minutes of the presentation, and I told you we were going to be eating an elephant, and you guys are doing a great job at this. Just as some final kind of touch points to wrap up the presentation. What happens if you missed your initial enrollment? Well, if it's right now or during this year that you've missed your initial enrollment, you're in the right time because we're in open enrollment. So everybody can enroll right now, starting today, October 15th. There is general enrollment that will also occur This is for premium-free Part A, and that can be added at any time. And if you did not sign up for Part B when you were first eligible, you can sign up with Social Security between January 1st and March 31st. So if you missed this open enrollment period, you can still enroll and your coverage would be delayed starting until July 1st. For Part D, if you signed up for Part B above and you were kind of late signing up for that, you will be delayed to sign up for Part B, but you can do so during April to June. And then your plan would begin July 1st as well. So there's some different enrollment periods if you missed open enrollment, but you're not going to because you're here and you're already paying attention and you're learning more about Medicare and your enrollment periods. We are in open enrollment right now through December 7th, and you can join, terminate, or switch a new plan, and that new plan will start effective January 1st. Also a reminder, that's when all of your deductibles reset. So if you've paid your Part B deductible this year, it's going to reset January 1st, as well as any other deductibles that you might have for Part B or for your Advantage plan if you're part of that. If you enroll in an Advantage plan and you realize into January or February you are not liking the coverage or it's not working for you, there is an Advantage plan disenrollment period from January 1st to March 31st. And this is where you can go to an original Medicare plan and then choose a Part D plan as well. So you can opt out of, it's kind of like opting out of your plan and going to original Medicare. There is also first year Advantage plan disenrollment. So during the first year in a Medicare, if this is your first year, you may disenroll from an Advantage plan and go to original Medicare and join a prescription drug plan with no penalties during that very first year. If it's your second, third, fourth year, you only have this window from January 1st to March 31st to disenroll from an Advantage plan. You may qualify for special enrollment as well if you move out of a service area. So I have an Advantage plan and it restricts where I am and then I move to another state. You may qualify then to enroll in a separate plan. If you move back to the United States from being overseas, if you move in or out of an institution or you're released from jail, if you lose employer coverage or union coverage, and there can be other situations. So it's always good to check in with one, your eligibility status with Social Security, and then you can go to that eligibility check in the Medicare.gov website as well to see if you're eligible for a change, or you can reach out to your MAP services office. We have the specific MAP services for Nevada, as well as our Roseman Medicare Center, and we can help you as well. It's also important, I want to point out to round out this presentation, that if you have a concern about your healthcare, the quality of the healthcare services that you're receiving, healthcare ending too soon, you didn't get the necessary healthcare, or other concerns, Levanta is a toll-free helpline, which is part of quality improvement organizations, and they help to monitor and check patient satisfaction, as well as can start looking into issues that may have arose for you under your Medicare. We also want to make sure that as you leave here, you are taking 3 simple steps to prevent healthcare fraud. Those steps include protecting your health information. So one of the things that we mentioned today, don't carry around your Medicare red, white, and blue card. Keep that at home. Don't carry around your Social Security card in your wallet. Keep that at home. Pay attention to any of the paperwork that you receive. Anytime you're billed for Medicare services, they're required to send you what that billing was. And so reading that paperwork to make sure that you are appropriately billed, and then report. If something doesn't look right, if you were overcharged, if you're getting charged for services that you didn't receive, you need to report that. And again, just some simple steps to protect yourself from Medicare fraud and abuse. Treat your Medicare card like you would your credit cards. Watch out for identity theft. Never give your Medicare information over the phone unless you're talking to an approved government agency like MAP and our Medicare or Roseman Medicare site, where we're going, Medicare call center, protect your information for you. Don't carry your Medicare card with you unless you need it to show coverage for a specific service. Finally, detect Medicare fraud and abuse Use a personal healthcare journal. Keep track of your Medicare summary notices and other billing statements that you receive. And you can access your information at www.mymedicare.gov so that you can track and make sure that the services that you're billed for are in fact services you received, that you are not being double billed, and that services were not ordered by your doctor's office that you never received. Okay, and then definitely you can, if you suspect Medicare fraud or abuse, you can call the provider to clarify billing charges that are occurring. You can gather information and documentation, and you can contact MAP, the Medicare Assistance Plan for Nevada, and this is a free and confidential service available. Finally, again, open enrollment, it starts today. We don't want anyone who's been part of this session to incur any penalties or delay in coverage. So make sure that you enroll by December 7th. If you miss signing up when you're eligible, you may pay more for life, and we don't want that to happen to anyone. And once you are enrolled, make sure you read your forms, make sure you read that fine print. And if you ever have questions, please don't hesitate to reach out to our Medicare call center or to Nevada MAP services. Thank you so much for attending tonight. We hope that you learned some valuable information.
Thank you all. Good night.